So now I'm going to try to give you a very quick overview for those of you, a lot of you in this room know all you need to know about crisis management system, cure violence approach, and some of you know all about our research, but we have to at least start on the same page. So I'm going to try to introduce both of those things, focusing on the research we did. I just mentioned focused deterrence. In New York, they call it ceasefire. These are not competing models because except for that red square, they share common elements. The common element is social services and support for people involved in street life and people involved in violence that need a way out of that life. Both of those models say people need housing, they need to get reconnected to education, they need to get reconnected to their families, they need legal assistance. Those are the same ideas. The thing that the crisis management system and the cure violence model have that's distinct is credible messengers, neighborhood-based, and not the absence of policing, but it's not controlled by police. It can be coordinated with policing at the upper management level, but it's not a street-level law enforcement operation. The Robert Wood Johnson Foundation funded, as I said, these startup sites. One is in Morrisania and one is in Bed-Stuy, both operated by the Center for Court Innovation under their Save Our Streets banner. Those were important because they were started for research purposes, so we collected data in those neighborhoods before the program opened up. And I'll explain why that's important. That map should be very familiar to you. So the dark blue areas are where there's very little violence, very few shootings. The red areas are where people are getting hurt by guns. And so you can't see it, but there's little dark squares in the red areas. Those are the locations of the programs the city funded. Many of you work in those programs. And the fact that you see all those little dark squares in the red areas means the city did its job right. It put programs where people needed help. But this triangle is here to suggest that we have three basic kinds of data in this study. The left top light blue area says program fidelity. We tried to get information about what the programs are doing, how well they were doing it, how often they did it, what the staff themselves thought, as a way of measuring differences between programs and intensity of effort. The next thing on the right says norm change. I mentioned Shayla managed the interview process. We did, I think, almost 6,000 individual interviews across the city with young men, ages 18 to 30, in various neighborhoods, and asked a bunch of questions about their life situations, their attitudes, and their thoughts about using violence, which I'll talk about in a second. And finally, the thing every policymaker wants to know, every journalist wants to know, yes, norm change is fine, attitudes are important, but what happened to violence? Did shootings go down? Did injuries go down? So we worked with NYPD and got data from OMAP at NYPD on shootings and robberies and homicides, coded at a small enough level that we could look at small area neighborhoods and track changes over time. We also got data from the New York Department of Health at the state level, hospital data, which we'll talk about in a second, and that allowed us to have a different lens on the violence problem. So police data can tell you where something happened, or where someone complained about something happening, or who got arrested for doing something. And those are all very important data points. Hospital data can tell you who showed up at a hospital with an injury due to violence, and where did they live at the time. So you can plot that map I showed you a second ago, plotted out the concentration of people showing up in need of medical care for injuries due to violence, with the data coded to their home address, so you really know where people live who are being hurt. Both valid measures, just different measures. All right. So if we just focus on violence reduction, though, I don't know if you can see that. It was in a report we released a couple weeks ago. The blue bars are before and after numbers. So if you can't read the titles, the blue are cure violence sites, and gun injuries are on the top group, and shooting victimizations are on the bottom group. The height of the blue bars, it's before and after, so it shows you whether shooting injuries dropped. The dark gray bars are the comparison sites. So when we look at a jurisdiction or a neighborhood and look at violence, we always try to match them up with a reasonably comparable neighborhood that doesn't have cure violence. And we match them on things like demographics. There's a thing called concentrated disadvantage, which you build from census data about how many employment challenges, income levels. So we match neighborhoods, and so each of those has a comparison neighborhood. This report was about East New York, and Flatbush was their comparison, and the SOS South Bronx and East Harlem neighborhood was that comparison. And basically it shows there were bigger drops in some of the cure violence areas. Almost, there's one that's a push, but most of them, the cure violence neighborhood had a bigger drop in both injuries and shooting victimizations than the matched comparison neighborhood. So that's promising evidence. This one we just did, this is using hospital data. So it's people who were injured by guns who showed up needing medical care with their address as the code for the incident. So not where they were injured, but where they lived at the time they were injured. The dark bars there are the comparison areas, and I'll just go through the cure violence areas. So who's here from Man Up? A. All right. So Man Up A, the comparison neighborhood had a 29% decline in injuries. Man Up had a 50% decline in injuries. South Bronx, 43 to 36. SOS Bed-Stuy, 50 to 31. SOS Morrisania, 58 to 40. Okay. And it's in the link and you can see where the matching jurisdictions are. All right, norm change. We interviewed people all over the city in these disadvantaged neighborhoods, some with, some without cure violence. The key part of this survey was we asked them 17 scenarios about when you would use violence. And this scale here that you can't read goes from 1, which says I would ignore it. The next, you tick it up a couple notches and you get to I would react verbally, I would react physically, and then I would pull a weapon to confront this person. I would use a weapon to confront this person. That's 9 out of 10. And then we had an unlabeled 10, where if you really want to go for it, we use iPads, they could actually slide the bar, and someone who's willing to slide the bar all the way to 10, past the words that say use a weapon, you know they're serious. And then we asked them a bunch of hypotheticals, ranging from simple stuff like someone stepped on my shoes, someone's hitting on my girlfriend, someone's trying to use our basketball court, to more serious stuff that involve pride and respect. Some of the ones that got the highest scores where people were willing to use violence in this hypothetical scenario were things like, I just saw someone wearing the jacket that everyone knows he stole from me. Or I'm confronting the guy that works at the bodega that owes me $200 and is refusing to pay. Things that involve money, pride, respect, tended to get higher responses. So we split them. We split the indices into those 2, which again you can't read. But the one index was called serious disputes. That's money, pride. The other index was about petty stuff. And we looked at changes in those 2 indices over time. These are some results. So the blue line there is the declining support for using violence in petty disputes in neighborhoods with cure violence. These are comparing 2 neighborhoods with and 2 neighborhoods without. The dark gray line underneath it is where the comparison areas were. So that's how much people agreed with using violence in a neighborhood without cure violence. And that's called a difference in difference analysis, and it shows some effect from having the program. That serious disputes, and you can see the blue line there falls so much that it comes down slightly below the comparison neighborhood. So that's also an indicator of positive change. And I just want to point out, these surveys were not done with participants. So we didn't talk to participants in the programs. We may have, but we didn't ask them, are you involved in the program? We just said, do you live in this neighborhood? Are you between the ages of 18 and 30? So this is more like a measure of general attitudes among young men in the neighborhood, which is, to me, pretty powerful, that if you could see a difference in a neighborhood that's doing crisis management system and cure violence compared to another neighborhood just like it that doesn't have the program, that's pretty powerful. We put this report out a couple weeks ago. You've probably all heard people say, oh yeah, that cure violence, that's a nice program, but they're anti-cop. I've heard that recently from people in uniform, and I always say, no, they're just not anti. There have been programs where some of the staff were definitely anti-cop, but that's not the program. This says, in a neighborhood with a cure violence program, trust and confidence in police actually goes up more than in neighborhoods without cure violence. And we've been pointing this out to law enforcement people recently, saying the programs don't have to be anti-cop. In fact, the neighborhoods, if you start talking about peace, put the guns down, don't use your gun, stop shooting, start living, if that message gets out, people actually start to think, well, maybe the police, there are some bad police, sure, and maybe most of the police are good and they're trying to help us, and maybe we can work with them and attitudes change, which is pretty important. And this last one shows in the cure violence neighborhoods, that question says, if you saw someone being beaten up or shot, would you call the police to report the crime? And the blue line are the cure violence neighborhoods, and the gray line is the match comparison sites. So more willingness to cooperate with police in neighborhoods with cure violence and crisis management system, which again, I think is a pretty important takeaway. That's it. We got to move on. Thank you very much.